Thank you, Mr. Chairman. Dr. Stein, I spent 40 years coaching, and all those 40 years, I saw the correlation between family and some kind of addiction. There's a direct correlation, and if we don't figure out something to do with family in this country and get back to mom and dad and discipline and responsibility, we're going to have a tough time and continue to have a tough time. Also, I saw over the years, I'd bring young men into my football teams, and of course, with their mom and dad, for 4 years, and we'd bring doctors in, and for first part of my career, we had a few that was on insulin for sugar diabetes or something, but my last 10 years, there was very few that was not on Adderall or Ritalin for attention deficit. Kids are over-prescribed by doctors for some reason. Do you see a direct correlation between over-the-counter drugs or prescription drugs that lead to addiction?
Thank you for that question, Senator. This is a question that scientists have been looking at. And so far, the data really suggests that there isn't a direct relationship between children receiving some of these medications and later addiction. But I also think it's important to recognize that we also do recognize that there is a relationship between mental health disorders in children generally, or in adults, and substance use disorders. And so I think it's important that recognizing that there is this relationship and individuals may have both mental health disorders and substance use disorders. I do think it's very important to make sure that not only while we're here focused on opioid use disorders and substance use disorders, to try to address the opioid crisis or substance use disorder crisis more generally without recognizing how many of those individuals also suffer from mental health problems really makes us suggest we're trying to fight that battle with one hand tied behind our back.
Do you think we need to roll back the prescription of childhood drugs of what I was just talking about a few minutes earlier?
Sir,
Are we overdrugged is what I'm asking at a young age.
So that's well beyond sort of the research that I'm currently involved in. As a clinician, I can say it's important that we need to make sure that we're using medications and other therapies appropriately. And that means making sure that individuals who are not being treated and may benefit from medications do receive them, and also making sure that we're not providing medications to children or adults who may not benefit from them.
Thank you. Mr. Duckworth, how have states like West Virginia used opioid settlement funds to fight back against epidemics?
That's a great question. The West Virginia First Foundation is brand new. It's in its infancy. So May of '24 was one.
How is it funded, by the way?
It's the opioid settlement money. So the executive director actually wasn't hired until May of '24. So between May and September, it took a lot getting the homework done, the policies, procedures, the staff hired. So we put an initial opportunity grant together that went out for application, receiving applications in September. So by the end of December, we've committed over $20 million. And most of it at this point has went to youth prevention and child advocacy. And I think we'd all agree that the hidden epidemic of our seniors isn't really so hidden anymore. So I can anticipate in the future having a lot more funding going towards the grandparents raising grandkids, the seniors. That's the direction we want to go in West Virginia. To answer your question on the short term, child advocacy and prevention, education, things like that is where it went recently.
Yeah, do you think there's anything that you use that we could do on a federal level to help more from this program?
I think Senator Scott's on the data sharing, education, the data sharing, the support for law enforcement. I think it's so important, and I love the mission that you're on there, and hope we can see that come together.
Thank you. Sheriff, we've heard a lot about how children are now able to purchase drugs which are often laced with fentanyl. And there's this god-awful stuff that you can go into one of these convenience stores and buy that all of it's made in China that's for some reason we're allowed to be sold here in this country. What can we do here in Washington to curb practices and raise awareness to parents about the things that the kids are able to buy.
Well, thank you for the question, Senator, and you're spot on. I mean, Chinese really created this epidemic, illicit substances, and now we've seen that the most recent numbers, actually 50% of the pills that are made in clandestine labs or somebody's dirty bathroom in many cases contain a lethal dose of fentanyl. And that's down from a 70%. 7 out of 10 people that were taking it for the first time were likely to die with a pill that was manufactured in an illicit environment. But we see these things, these trends. It was just yesterday when we were talking about methamphetamine, MDMA, flunitrazepam, rohypnol, where roofies were available. And then things got confusing for Americans with designer drugs, where they would walk in and illicit chemists would stay one step ahead of what the DEA would approve as illegal, and we would clean the shelves off. I think we have that under control now. There's no longer a problem in this country of overprescribing. Clearly, you have to have your head in the sand to not realize that we have a problem that's down at our southern border with Mexican chemists now picking up precursor chemicals from China and learning how to process this. But education is so incredibly important. That's why when we talk about greater access to opioid antagonists, the most significant thing that we can do to prevent people from having a drug overdose is never starting. But many of us remember Nancy Reagan saying, just say no. Well, just say no works incredibly well if you've never started. So when people have started on a regimen, we have to give them access to science-based, medical-based treatment therapy combined with cognitive therapy, and not just do that for the person on the journey. Make sure that the family members and the loved ones and partnership with businesses and corporations the private companies have a big role to play in that, because many people who are on this journey are actually going to an environment, whether they're going to a public school system or that type of environment, or they're going to work. Somebody is formally supervising them, and when they first see the first signs of it, it's important to not only say something, but know what resources are available and stay current with the current trends. Lastly, we all remember the program DARE, which was an incredibly successful program across the country. But DARE had nothing to do with what the challenges are of our kids today. Sexting, texting, cyberbullying, vaping, all of these other things have to be incorporated in educational curriculums K through 12.